So good morning, everybody. We're going to be looking at the health and social care sector unit today. Now, on this section, it's going to be learning about the organizational structures of the health and social care and so on with that. But what I'll do is, if you can see my screen, I'll show you this document in front of me. This is the unit specification sheet. Now, on here, as you can see, it says the health and social care sector. Hi, good morning. I've just had somebody join in now, but let's carry on. So, like I was saying, this is the unit specification sheet. Now, on here, you have three grading structures. You have a pass, a merit, and a distinction, which I'll explain in just a moment. Today, we're going to be looking at the learning outcome is understand the organizational structure of the health and social care sector. So within this, you have a few questions, which we call assessment criteria. Within the past section, which everybody needs to attempt, is 1.1, explain the overall structure of the health and social care sector. Then we have 1.2, which is explain the role of the health and care regulators and watchdogs. And then we have 1.3, which is explain the role and responsibilities of staff in the structure of a named health and social care organization. So if you would like to go for the pass grade, you just need to do these three questions. If you're wanting to do a merit grade in this, you need to do all the three pass questions along with this one here, 1M1. Explain the continuing professional development needed for progression through different career pathways. And then we have a distinction question. So if you wanted to go for the distinction grade within your qualification, you would need to do all of your pass, all of the merits, and all of the distinctions throughout this unit. So the distinction question is, evaluate the structure of a named organization in the health and social care sector. So if you have any questions, please unmute yourself throughout, and you're welcome to ask at any point. So this is one of the documents that you would have had emailed over to you, but it's also available on our learning module on our Moodle, which I'll go through in a moment. Now, this is just to show you what this is. It's just the assignment brief. You don't actually need to look at it at the moment. You're very welcome to, but this is something that we'll be doing in our last session when I set the assignment, and it just sets out a structure of how the assignment is going to be based. So if everyone's okay, I'll make a start on our lesson. There you go, it's loaded up. So we're going to be looking at the health and social care sector and at learning outcome 1 specifically today. So today we're going to understand the organizational structure of health and social care sector. So like I said, there's a few learning outcomes. You got 1, 2, 3, 4, 5 learning outcomes within this, 1.1, 1.2, 1.3, 1M1 and 1D1, and we'll go through each assessment criteria throughout this PowerPoint. So our unit aim for today's session is to develop an understanding of the structure within the health and social care sector. We'll also look at how legislations and the codes of practice can impact on the provision, and we'll be looking at multidisciplinary working throughout. So over here, we've got two charts, two diagrams, which actually show the overall structure of health and social care sector. Now, if I can zoom into these a little bit, if it'll let me do that. And no, it's not going to. What this section actually doing is, oh, sorry, I apologize, we're just jumping ahead. So on this, we just got two different diagrams. The first one is about the structure of England. It goes through, at the top is the Department of Health. Then we go down into NHS England, then NHS Improvement, and the Care Quality Commission. So the Care Quality Commission is a regulator or a watchdog. They actually make sure that things are being done in the correct way. And we all know NHS England is the health. And then offshooting of that are different authorities and different services that are offered. Within our next circular diagram, this actually just shows us the health and care system, and it just goes through. Now, these diagrams are some diagrams that images that I actually encourage you to use within your answers, because they're quite self-explanatory and it'll help you. It just makes it a lot more fun. So when we get onto the assignment brief in a couple of days, I'll explain what we need to do. So we're going to look at the Department of Health's aim, the role of the Department of Health in the new system, okay? So the aim of the Department of Health is to help people live better. So allow Rachel to join. It's to allow them to let people live better and for longer. The Department of Health also makes sure that they shape, lead and fund the healthcare in England. And this is so that the residents of England will have adequate support and that they're given the care and treatment that they need, but also dealt with in a compassionate and respectful way, and they have the dignity that they deserve. Now, care, compassion, respect, dignity, this is something that is a continuing factor throughout health and social care unit. So it won't just be in today's unit, you'll see it in person-centered approach. It's a very big thing that we focus on. Hi, good morning, Rachel.
Morning.
Good morning. We've just started, Rachel. We're only a couple of slides in, so I'm just going to continue. You've not really missed much, to be honest. What we'll do is, if I can ask you to mute yourself, and if you have any questions, please unmute and feel free to ask them. Thank you. So the common purpose of the Department of Health is to create a good working system. It's where you have different organizations that actually work together. And this is something called multidisciplinary working, where you have like social services, care organizations, the NHS, police, schools. They will all work together. Hi, good morning.
Hello.
Sorry. Hi, how are you?
I'm fine. This is Ganiat.
Hi, Ganiat. It's good to hear you again.
Yeah, thank you.
You've not missed too much, Ganiat.
From work.
Oh, no, that's fine. No worries. You've not missed too much. We've just started, so I'm going to continue. Okay. And if you can mute yourself and then just ask a question by muting afterwards. Thank you.
Thank you.
So like I was saying, that the whole purpose of the Department of Health is to get different organizations to work together. And this helps like social services and health services to deliver responsibly deliver services within set objectives and budgets. Now, we've also got the Secretary of State, which comes into the mix. So overall, the Secretary of State has the ultimate responsibility for making sure that every organization within the whole system actually works together to meet the needs of the patients.
Okay.
Sorry, my computer's running a little bit slow, so it'll jump to the next slide soon, hopefully. Ah, there you go. It came up. So over here, we've got a chart which you can see the overview of the health and social care structures. This is within the Health and Social Care Act. So this act is quite a big part of Learning Outcome 1. Now, within this, you can see the public health on here, which is over here. Then you've got the NHS and you've got the adult social care. Now, right at the top are the ministers of the department, but they're like the central government. And then you have like a national level over here. This is in a government speaking. And then you have local authorities over here, and it shows the different responsibilities that each one has. And right at the bottom is the overall care for the patients and the public. So it's going through this chart, is telling you what the responsibilities are within these particular little sectors, and the overall outcome is for the patients and the public. So now we have got the Health and Social Care Act of 2012. Now we're going to go through these, and the following is going to show us some responsibilities that are covered within this act. So I might just read through a few points on here. So from the point of view of the patients and the public, access to the NHS services are given on the basis of need. It's not about having the ability to pay for it, because as you know, in some countries, like for America example, you're going to have to pay for every single health service that you need, but obviously within the NHS, that's not the case. So at a local level, authorities will have a much stronger role in shaping services, and they're going to start taking over responsibility for the local public health improvement. So new health and wellbeing boards also bring together local commissioners of health and social care, and these have been elected representatives of the Health Watch, and they agree to integrate, meaning to work together to try and improve healthcare and also the well-being of patients. Because there was a point where healthcare was focused on, but well-being wasn't really taken into factor, but now that's all changing and we're improving in that service. We've also got here where most of the NHS care is commissioned by clinical commissioning groups, and these give GPs and other clinicians responsibility for using the resources. So we've got NHS commissioners who are supported by a new body, and this is called the NHS Commissioning Board. Now, this board actually authorizes clinical commissioning groups, it allocates resources and commissions certain services like primary care. It also has like clinical networks and clinical senates where they're advising on single ideas of care, or they're advising on commissioning plans. So there's quite a few things that are detailed within this. The NHS providers actually no longer their performance is not managed by the strategic health authorities. There's a consistent system of regulation for every provider, and the CQC, the Care Quality Commission, actually ensures that these requirements are met so that the safety of the patients, the quality is maintained, and that things are actually getting done in the way they should be getting done, so that there's no lack of care or responsibility within that. So what will happen is you'll get monitorable temporary, I can't speak, I do apologize. So you will temporarily also retain oversight of foundation trusts, but while the NHS Trust Development Authority is getting set up, its remaining things will actually go to the NHS Trust Achievement Foundation status. Now, there's a number of things that are actually not in the Act, but we are mentioning, like we said, the NHS Trust Development is not within the Act. The Health Education England is not within the Act either, but they give you like an oversight and leadership to do with education and training, which we're going to be looking at further along when we get into the CBD, Continuous Professional Development section. So the National Institute for Health and Care Excellence will actually continue to provide independent advice and guidance for the NHS, and it sort of extends its role to the social care sector also. And then we've got the Ministers of the Department of Health. They're still accountable for the NHS, but they don't actually directly manage anything at the moment, but they just sort of like hold it into account. And then the action is to protect and promote the health of the population against the service here. So if you unmute yourselves, just so I know how we're getting on with the first section, and then we can go on to AC 1.2.
Okay.
Thank you.
Is everything okay so far?
Yeah, sure.
Fantastic.
From Charity, please. I think
Hi,
it's
Charity.
I think it's just about history, isn't it?
It's what, sorry?
History of.
Yeah, this is just the history part.
Okay.
Yeah, you'll notice that in a lot of this, the first learning outcome is just about how the structure was set up, what the history of the NHS is. You'll go through that quite a lot in here, and also things like the acts that maintain it and things. Right, so if everyone's good, I'm going to go on to assessment criteria 2, which is explain the role of health and care regulators and watchdogs. There you go. So with this, what we're going to be looking at, what actually regulators are and what are watchdogs. So just to clarify it in the best wording, I'm just going to read through this little section here. So regulation plays a major role in health and care industry and the healthcare insurance coverage. So the various regulatory bodies protect the public from a number of health risks, and they provide numerous programs for public health and welfare. And together, these regulatory agencies actually protect and regulate public health at every level. Can I ask, is everybody aware of what regulation actually means?
I think these are like laid down rules and principles guiding a particular sector.
Yes. You're perfectly right. Thank you, Charity. That's right. Regulation is just making sure that you're following a certain set of rules, like whether it's in any type of profession. You could be in working as a salesperson on a shop floor. You could be in the teaching and education sector like myself. You could be in healthcare. You've got to make sure that you're following a certain set of rules so that you're working towards the right levels and that you're following the guidance that has been given to you. Hi, good morning, Joe. Hi, good morning, Joe.
Good morning.
Morning. I'm Asha. I'm the Health and Social Care Tutor. We're just into our second question at the moment. I'm going to carry on. We have recorded this session, so you'll be able to catch up to what you've missed out on.
Right.
I will ask, if you don't mind, to put yourself on mute, and then if you have a question, unmute yourself, and we'll be able to answer anything.
Okay.
Fantastic. So just a very quick recap, we're talking about the regulators, and we spoke about what regulation is. Charity gave us a really good overview of what it is, that you're following a certain set of rules. So within regulation, we have other people, other industry like the CQC and then the Care Quality Commission. Now, this was actually established in 2009, and they're an independent commissioning board which actually regulate health and social care for England. So they make sure that you got your registration, your regulation, and they're doing inspection, and they rate all providers. It's sort of like Ofsted for education, but this is on the health and social care side. So here are a list of health and social care regulators. Now, we've got a couple of slides of these. There's a lot of them. We've got the General Chiropractic Council, which is GCC. They regulate chiropractors. We've got the General Dental Council, and they do dentists, dental therapists, dental nurses, just anybody that's got anything to do with dentistry. General Medical Council is for doctors. General Optical Council is for optometrists and opticians. General Osteopathic Council is for osteopaths. Then we've got the Health and Care Professions Council, HCPC, and they regulate art therapists, biomedical students, any physiotherapists, psychologists. So there's an extensive section here showing who they are, like radiographers and speech and language therapists. Then we have the Nursing and Midwifery Council, NMC, and they regulate nurses, midwives, specialist community public health nurses. And then we have the General Pharmaceutical Council, and they regulate pharmacists, the technicians, and also the premises where the pharmacies are, to make sure that they meet the code and standards. And then we have the Pharmaceutical Society of Northern Ireland, which is short PSNI, and they also again do the same as the other, but they do pharmacies and pharmacy premises in Northern Ireland. Then we've got Northern Ireland Social Care Council, and they regulate the Northern Ireland social care workforce only in that country. Then we've got Social Care Wales, and obviously self-explanatory, just for Wales as social carers. And then Scottish Social Care Services Council, and they're responsible for registering people who work in social services. Now I'm going to go on something called Revalidation over here now. Now, this is a little excerpt that we've put into here from the various books and resources that you can read. It's quite a nice little overview of just some of the things and services that are followed. Right at the top, we've got something called revalidation. Now, revalidation is actually a process that clinicians need to demonstrate to regulators that they're actually fit to practice. So they've got to be following certain rules, certain procedures in the way that they need to be done to show that, right, we can do this, and so that they can get regulated properly. So this little section is just about, you know, the Care Council. We've got the Trust Development Authority here. We've got some information on the Care Quality Commission. So it's a nice little read. It's General Medical Council and the Nursing and Midwifery Council. So you've got a few little things in here which will just pinpoint what their services are or what sort of responsibilities they have. So if you could unmute yourself, if you have a question, just let me know, because we're about to go on to assessment criteria 1.3.
Yeah.
So are you okay? I know you joined in a little bit late, but are you okay so far with what we're doing? Yep, I'm going to take that as a yes. Oh, fantastic, Stephanie, thank you. Right, so 1.3, and this is about the structures within health and social care. So 1.3 is explain the roles and responsibilities of staff in the structure of a named health and social care organisation. Right, so, oh dear, I'm always doing this. Let me get back to my normal page, and then we'll be good. Right, so we're going to be looking at the roles and responsibilities of different organisations. So we've got the social services, NSPCC, health visitors, GP. Sorry to interrupt, but may I just ask whoever's got a bit of rustling in the background to mute themselves? It's just that whoever wants to listen to the recording later will be able to hear it clear. Thank you. Thank you. So we've got the NSPCC, health visitor, GP, probation officers, police, school, and psychologists. So we're actually going to just be looking at 2 of these now. The rest of these services will actually have be explained right towards the end. We've got a couple of extra slides in there. So we'll be looking at social services and the GPs in the next couple of slides. So, like it says over here, each agency has got a specific role, and this is just a very small list of some of their roles and responsibilities. So the social services, they'll provide support for vulnerable children. They're responsible for coordinating and implementing interagency. Sorry, just one moment. There you go. Sorry, I just lost my train of thought there. Where am I? There I am. So they're responsible for implementing interagency child protection and also safeguarding children. They'll make inquiries, they'll work with schools and the NHS. They'll remove children if they're in immediate danger, and they'll also, deal with courts and so on. And they're also the principal point of contact. I have done charity, yes. And they're also the principal contact for that child if there's any concerns that they have. And now we'll go on to GPs and their roles and responsibilities. So the GPs, they know when and how to refer a child or young person to social services if they've got any issues about abuse, neglect or anything else. They'll be informed immediately when other members of primary health care will become concerned about the welfare of a child. They'll discuss their concerns with colleagues who have a lot more experience in child protections. They'll share information with social services. Like I said, different agencies working together is extremely important that this happens now, especially because when we hear about cases like Baby P and Victoria Klimbay, it's fantastic that we've got the services working together. They'll attend child protection conferences and they'll also only make available relevant information about a child and its family. So they're not going to give out irrelevant information about anything. And as employers, GPs are responsible for their staff and they need to ensure that their practice nurses, managers, receptionists and every other person that they employ have got child protection training. And that's, I think it's in a whole wide range of industries now where child protection training is extremely important. That is something you really need to be on the ball about. So that was GPs and social services. We're going to go on to our merit question now on here. Let's see. So 1M1. So 1 merit 1, which is explain the continuing professional development needed for progression through different career pathways. Now, I love CPD. It's something that I'm always doing, and it's a fantastic tool to be improving yourselves within your own profession. So what is continuing professional development? So we've got a few things over here. So we're going to look at CPD, and obviously this stands for continuous professional development, like I've just said. So regardless of what your profession actually is, if you're a nurse, a doctor, you're in healthcare, or if you're in teaching, or if you're in a business environment, CPD, continuing professional development, is extremely important. Now this is where you're actually developing your own professional skills. So what I'm going to do is I'm going to unmute you, and I would like to ask you some questions to see what you know about these things. So Charity, if you can unmute yourself, please. There you go. Hi. So I'd like to ask, now we've got a number of things over here. Every time I click, it just takes my screen everywhere else. Let's go back to my page. So we've got something called interactive learning. Do you know what interactive learning is?
Yeah, can I answer? Yeah, interactive, let's say it's like a discussion between the teacher or the tutor and the student.
Charity, you're impressing me today. Well done. Yeah, it's like discussing, questioning, challenging, just any sort of interaction that you're having with a colleague or anyone else. That's fantastic.
That was Gania. not Charity.
Oh, was it Gania?
Stephanie.
I apologize. But you're impressing me very much. Fantastic. So, yeah, that's that. And then what about participation-based learning? Does anybody know what that is?
Taking part.
Yes. Fantastic. Is it Stephanie again?
Yeah.
Yeah, fantastic. Yes, taking part. So I'm just going to, if you're able to mute yourself, if not, then I'll do it for you.
Please help me, because I'm using my phone. It's difficult.
I'll do it now for you. Thank you. Yeah, I'll just be one moment. I'll just mute some of. There you go. Yeah. So we've got interactive learning, like Stephanie fantastically put it. It's just about where you're interacting with other members of staff, colleagues, anybody else that you're learning things from. So this is where you're discussing things, or you're questioning things, or you're challenging certain aspects, or you're just even making sure that, right, is this correct, what I'm hearing about, or even correcting someone. So say if someone says, right, this is how we do this procedure, like, no, actually, this is the right steps to do it. Then we've got something called participation-based learning. So this is where you're actually participating in certain things. So you're either attending classes or courses or trainings. So that's all it is. So you're attending certain things. And then we've got independent learning. Now, this is where you actually set your own goals and where you monitor and evaluate your own academic learning. So CPD is done in 3 different ways. There's a million things that come underneath this. And now we've got a question here. Why is continuing professional development, why is it integral to the role of health and social care practitioners? So from my understanding, this is because we know that taking part in well-crafted CPD has got loads of benefits for not only yourself, but also for the public, because you're offering a service as health professionals to members of the public and also to your colleagues. You're passing on, you're making sure that you're maintaining and also enhancing your own skills. So we all know that after a while, certain things that they just become like motor knowledge, don't they? You understand, you know how to do things. But when someone asks you, how do you insert a cannula, you can physically do it, but you might forget how to tell them about it. So CPD will just make sure that you're maintaining your knowledge, you're enhancing your knowledge, and also you're developing your own skills. And this is like a very good service that you're developing, not just for yourself, but also for your colleagues and for the community. Because you might have learned a certain skill, and then you might be able to pass that on to a member of staff that works with you. So it's always a win-win situation when you're doing continuous professional development. So this is a CPD progression and career pathway image that we've got here. Now, this is about health and social care sector. So when you're in, we can zoom into this. When you look at the PowerPoint, I'll show you exactly where to go. It just goes through the different progressions in the health care sector that you can go through. Either it's for to be a nurse or a care home manager, or what sort of courses you need to take, what steps you would need to take. So this is a fantastic image that just shows you what sort of steps can be done. Now, next, we're going to look at this here. So it's asking, why is CPD, why is it vital for NHS staff? So CPD is actually written into the NHS Constitution. It says within that Constitution that you need to invest in the skills and development of full and part-time employees. So this is something that has to be done within your workplace. You need to be offered certain progressions and trainings while you're working. So CPD isn't just important for So CPD isn't just important for career progressions, it also improves the quality of care, as it ensures that all staff have the skills that they need to be able to treat patients. So if you're asking somebody to go in and take a blood test, but they've never taken one, or they're not 100% sure on it, you can't really likely say to them that you need to just go and get on with it. So even if there's another member of staff walking them through, or they're shadowing someone, that is also CPD. So little steps, little things that happen in a daily life, you don't even realize it, but you're taking part in CPD. So CPD is actually fantastic news for everyone. So all NHS staff complete annual developments and reviews. They create personal development plans, which I love, by the way. I love having a personal development plan. It gives you something to work towards and to achieve. So it gives them the opportunity to learn new skills, they take on new responsibilities, and they can even progress into a specialism. So it's actually written that nurses and midwives actually need to complete a minimum of 35 hours of CPD to comply with the Nursing and Midwifery Council. So, but also doctors need to complete CPD to maintain their registration as well. Is that with myself as a teaching member of staff, I need to have a certain amount of hours of CPD that I can maintain on a yearly basis. So it's important for every profession that you do maintain it. So we're going to look at what counts as CPD. So we've got a few things as a generalization. I'll tell you what counts as CPD. So you've got things like observations, where you're just shadowing someone, or you're looking at what they're doing, or you just sort of like might have gone into a doctor's, a GP's room, and you're just seeing how the doctor's actually dealing with the patient, or you're seeing how a certain procedure is done. You attend courses, so either this can be physical courses where you're going in a classroom base, or most likely it's where you're just doing online learning, or you're getting the materials, or even today, this is your CPD, you're attending a course. You're reading through materials and resources, you're attending reviews of your own performance, or having assessments made, or making assessments of others' performances. You have appraisals, discussions, and webinars. So there's a whole load of things that you can actually have that count as CPD. So there's a couple of other things here. We've got conferences, which face-to-face ones aren't really happening at the moment, obviously, but you can attend them over the internet, which brings us into e-learning, where you're just using either you're joining a course online, you're doing some research, and then you also have informal learning. Like we said, you're observing colleagues, you're attending meetings, or you're reading a book. So all of these actually count as continuous professional development. So is everybody okay with this section before we go on to our distinction question? Yeah, fantastic. Thank you, Stephanie. Yes, we're good. I'm going to presume everybody else is okay as well. Oh, fantastic, Charity. Right, so let's go on to our next little section here. We're almost to the end. So 1D1, so this the distinction. For the learners that missed the beginning, I'll very quickly recap over our grading system towards the end. So 1D1, evaluate the structure of a named organization in the health and social care sector. So for this task, we're actually going to be looking at the National Health Service. Like, I think it was Charity in the beginning summed up for us that this section just looks like it's a historical overview of the NHS, which she was right. We're just looking at what sort of structures are within it and how it's actually been developed. Now, we're actually going to look at how the NHS was structured initially, what happened throughout the years, and what it looks like. And then we'll look at something called devolution and how it's going to affect patients and doctors. So let's make a start on that. So this is just going through an initial structure of the NHS. This is a fantastic set of slides that will actually help you answer the distinction question. It's not going to be where you're going to copy and paste. You'll have to look through this and reword it, paraphrase it, or summarize it. So just a couple of points I'm going to read on here. So for the first few decades of its existence, the structure of NHS had a tripartite system, and it was made up of the following services. It had hospital services, primary care services, and community services. Now, medical professionals soon called for this system to be unified. Like I've mentioned a few times earlier, that obviously we need to be working together now with other systems and organizations to have a more generalized, holistic view of for patients, just to make sure all of their needs are being met. So this is over here. Now we've actually got, if you remember on slide 3, we had a little diagram of the NHS structure. That is a fantastic thing to go with this question here. If you're having trouble hearing me, please let me know, because I've just had a message come up saying I've got poor quality on here. So please let me know, and then I'll switch my audio. Stephanie, I've unmuted you. Can you hear me properly?
Yeah, okay.
Fantastic. Please message me, anybody, if you have issues hearing me, and I'll switch my audio over. Thank you. Fantastic. So we're going to go on to our next slide here. Right, so what happened in the later years of the structure? Now this just actually has a quick overview of what happened, how it was developed. So we've got something called the Black Report that concluded that despite the foundation of the NHS, poorer people had a higher infant mortality rate. So their babies were passing more than people that had a bit more funding. So, and then we pop down to the NHS and Community Care Act of 1990, and it gave regional health authorities budgets with what they could buy provisions and what sort of services they have. Sorry, let me see if I can fix this audio. Yep, that's fine. And then in 2003, the Labour government introduced payment by results. So it's where the NHS bodies get given a certain amount of money, but it's based on how many patients that they actually see. So it's cost efficient, and it also risks services being too target driven. So it's like having a high turnaround of patients, but the care might not be given that they actually deserve. And then we've got a little bit more about the Health and Social Care Act and how it overhauled made a structural reform of the NHS. Then we talk about the Department of Health and how it's responsible for funding and also the policies within the healthcare. And then we just go on to NHS England and then go on to regulatory bodies like the commissioning groups and exactly what they do, like we mentioned earlier, that they regulate to make sure that services are being provided in the way they should be provided. And then we've come on to devolution, onto this section here. So I'll have a quick tell what devolution is. So this is where the responsibility, so originally the NHS was maintained and governed by the central government, but now what they're doing is the responsibility has been passed from the central government to the separate powers in Scotland, Wales, Northern Ireland and England. So it's not just being sorted out within Westminster and one group of people are, sorting out the whole of the UK's health services. They've been passed on to the separate countries. Now, what they do is they've allocated funding to these separate countries to decide what you want to do with them. They said, this is your money now, you decide how you want to spend it on the NHS. There's Another thing that is actually coming out on a regional level is, from my understanding, is still in process. There's something called Devolution, and this is a project that's been initiated by the government, and it's what they're trying to do is give the health and social care responsibilities to authorities within Manchester. So it's still quite early and it's still quite experimental, but it's still the judgment is still out there whether or not it's going to work or not. So if Devolution goes ahead and it goes well, this devolution could mean that services are more aligned with the needs of the specific regions. So they might have more benefits to the local population health. Some people actually worry that devolution will complicate an already complex system, which is a good worry actually, because it is complex and it could happen, and that it might distract from the basic care provision. And then they also say, people are in general are still worried that with any reorganisation there's a risk of redundancies, and that it's up to the Manchester authorities to decide whether they want to increase or decrease the amount of private sector services that they commission in. So in the past, NHS workers have found themselves transferred to the private sector, which it has implications for pay, benefits and job security. So like I said, the Devolution is still in development. We're not exactly sure on what the judgment will be about what it is, but so far there's plus points to it, and then there's also negative points to it, like everything else. And then over here, when we actually do get onto the distinction question, what you will need to do, and I'll discuss this next Thursday in a lot of detail, but you just pick an organisation, a care home, the NHS, Bupa, a GP surgery. You'd put down an organisation chart, and then you'd just explain what services they provide and the history of this. And then this is just some other references of what we've taken our information from. Now, before I finish this off, if you remember with the question 1.3, where it says explain the roles and responsibilities of staff in the structure of a named health and social care organisation, this is actually just some of the roles and responsibilities of psychologists, of the hospital services, paediatricians, midwives and health visitors, and mental health care services, and so on. So it's just a nice little read through if you want to look at some of the other services that are offered by other people. So I'm going to unmute everyone because I'd like to have a nice little chat. What I'm going to do is I'm going to stop the recording, and then I'll go through whatever some of you have missed out on, and we'll go through how to access this work via Moodle.